व्हेक्टर-बोर्न दुयेंसांचेर नियंत्रण हाडपा खातीर मुरगांव ब्लॉक कमिटीन हालींच मुरगांव उपजिल्लोधिकाऱ्याच्या अध्यक्षतेखाला एक म्हत्वाची बसका आपयली. ह्या वाठारांत मलेरियाचो वाडपी धोको नियंत्रणात हाडून ताचेर उपाय काडपा खातीर ही बसका खासा आपयल्ली. भलायकी अधिकारी, थळावे प्रतिनिधी आनी समाज फुडारी आशिल्ल्या ह्या बसकेंत मलेरियाचो प्रसार आडोवपा खातीर सक्रीय अशे उपाय मांडले. RDXGOA खातीर मुरगांवच्यान प्रसाद नायक.
See, today was the Mormugao block committee meeting on prevention of vector-borne disease. This is a committee which is formed in all the blocks all over Goa, and Goa was involved in arranging to set up this block committee meeting because the purpose is to get the support of the line departments like Labour Department, PWD, WRD, the panchayats, municipality, to support the doctors in their campaign to reduce vector-borne disease. Now, one of the this meeting is held quarterly. So, in this year now, this is the first meeting. We take it in the financial year, and so today we discuss how we can get the collaboration of the line departments and also agencies like MPA, Mormugao Port Authority, Goa Shipyard, to conduct the programs on malaria eradication and awareness. See, as you know, 25th April is World Malaria Day. So in today's discussion, we are also trying to see how we can harness the potential of these members of this committee. And we are also looking at this block addressing not only the issues of Vasco City with the cooperation of Mormugao Municipal Council, but also the village panchayats which come under the Kasavali Health Center and the Partali Health Center. So as you know, there are various committees in the panchayats. And now this is what I also want to show to you. This is a newly set up arrangement where public can get involved in tackling the health related issues.
Today we had a block level meeting regarding the vector-borne diseases which we have every quarterly. Today we had a discussion about the dengue and malaria cases and how we can plan during the monsoon, pre-monsoon and the monsoon season. We had all the departments like PWD, irrigation, then municipality and the panchayats involved. This block involves Mormugao, that is Kasavali, Konkani and Vasco. So we, for 25th, as you know, 25th is the Malaria Day. We will be starting activities for the malaria program along with the help of these municipalities and all the wards and ward councillors involved, so that we clean the areas wherever there are hot spots where the malaria breeding can occur, especially during summer season where they store water outside their houses. This has to be activities have to be done. IEC activities will be conducted where we will explain to the people and to the councillors. But the municipalities help also, which they are doing, helping us to collect the tires, other thrown out materials, plastic bottles and all. It has to be done before monsoon only, so that we can prevent the accumulation of water in these places.
Vasco has always been on the red alert when it comes to vector-borne diseases. What does the figures of the last year say, and how is going to be the situation this year?
Compared to last year, these 3 months we had a single-digit figure for dengue and malaria. 1 and 8, I'm not exactly this, but last year we were in the double digit. Comparatively, these 3 months we are well in control of the situation.